Vice president at Westat, a major research corporation in Rockville, Maryland. And in preparation for this talk, I asked her, you're vice president of what? And her response was, well, you know, Westat isn't really big on titles, so I'm just vice president. So because that's kind of a weak title for all that Babette really is, and I know this because I work very closely with Babette on the DC choice evaluation. She's the project director, I'm the principal investigator. So I figured I'd give her an additional title. She really is my project wife. And you'll notice Kathleen isn't here. Okay, so, and in fact, so much so that when Babette in the past has been working on her other major research project she supervises, the Classroom Literacy Interventions and Outcomes Study, or CLIO, I often think Babette is cheating on me with CLIO because I want all of her time to myself. But fortunately, she's going to give a little over an hour of her time to us in presenting the results of this major preschool literacy intervention that her team at Westat has been evaluating over a very long period of time and has learned a lot about. So I give you Babette Gutmann.
Thank you. Oh, well, there's so many ways I could go with that, but I told Patrick, I said, I don't do jokes, so I can't tell a joke. So he said he'd tell one for me, so I guess that was the joke. Although,
that's pretty good.
Is that good? His or mine? This study began in September of 2001, and I'm not going to take you month by month, year by year through it, but I will raise this question, and you guys can answer it at the end. If a tree falls in the forest, will anybody hear it? And I think of that often with this study. This was a very big study. I'll start out by telling you how much it cost to do this study, and then when you see the findings, we can have a conversation about that. It was about a $30 million study. So it was a big study, as Patrick said. That's why it got a lot of my attention. So I don't know how much you all know about the U.S. Department of Education, and I will find myself digressing, and then Patrick or somebody will kind of try and bring me back, because I could either talk all day or say very little. We'll see which way this goes. I'll try and stick to the slides. So back when this contract was awarded, there was this agency called the Planning and Evaluation Service, and they did planning and they did evaluation. And in 2002, Congress authorized, forgot the name of the law, but anyway, it put into existence the Institute of Education Sciences, IES. I suspect many of you in this room have heard of. And they were tasked with actually doing the rigorous research. So this project, which had been funded into one agency, got moved into another agency. Russ Whitehurst became the director. He cared about early childhood. He came from an early childhood background, doing work in early childhood. I think he was at SUNY. So we spent a year designing the study. We spent a year renaming the study. We spent a year developing a logo for the study. And for those of you all who are in graduate school and think that it's about, you know, statistics and methodology, it's about naming studies and doing logos. And I'm not kidding. Am I kidding, Patrick? All right, I'm not kidding. So I had a client, my core really cared about this. So I'll just skip all the titles, skip all the logos. But what you have there is a parent and a child reading together. I have to take my word for it. And with colors and the whole bit, because green was her favorite color, so you have to read in there. All right, so now it's February 2003, and we actually had an approved design. So that was very exciting, and I will now proceed to tell you about the design. Okay, before we do that, we have to talk about what Even Start was. And before we do that, so we have IES, and their rigorous evaluation, of course, means random assignment. And they were really into interventions, kind of trying to find out what works like, you know, in the health field, we try and find out what medicine works. So idea to try in education to find out what interventions actually work. So I'm going to first talk a little bit about Even Start, because you really won't get the study unless you get the platform we tried to do this study on. So Even Start is a Congress is fond of Even Start, and it started slow. It started as a demonstration program. The funding level kept going up. Congressman Goodling was the father of this. And it's a family literacy program. And nobody's ever really decided if a family literacy program works, but it just sounds good. So here we are with Even Start. So it's to help parents become full partners in the education of their children and to assist children in reaching their full potential as learners. Nobody's against that, right? Makes sense, right? Well, how do you do it? So you've got 4 components. So you think about these districts that have to do this. I mean, just think about what all's required and how hard this is. So you have to do, and we put up on the slide early childhood because that was the focus of the study, but really it's kids 0 through 8. So Even Start can provide services to infants and toddlers, which generally takes place in a home-based setting, early childhood education, classic preschool education for 3 and 4-year-olds, parenting educations where you work with the parents, so you help parents become the first teachers of their children. And this idea that I think is fairly unique to this family literacy program, which is kind of putting parents and children together and helping the parents understand how to work with their children, and so the parents give the children cues and get the cues back. So it's kind of this parent-child activity. And then adult education. And interestingly, you qualify for Even Start as an adult if you're eligible for adult education. Then your family qualifies for Even Start, and any children 0 through 8 qualify for Even Start. The types of adult education services, you can see why this would be attractive to parents, is they can get their GED, they can get English as a second language, they can learn English if English isn't their first language, and adult basic literacy. So the idea is to kind of help these adults be literate, and then you spill that over to the child. I'm not going to bore you with them, but let me just tell you there are 14 legislative requirements. 14! I mean, and each one like biggie. Okay, so here you have it. When we started this program, the Even Start was funded at $250 million, which isn't, I mean, we'd all like that, but it's not a lot of money, quite frankly, to do everything they have to do. And since then, each year they've gotten cut. The administration is increasingly zeroed it out. Congress has left it in. It's now down to $66 million. So what they couldn't, which I would argue they couldn't do with $250 million, now they're going to try and do with $66 million. So what was challenges for them, but challenges for us as we're designing this research project, is thinking about the decisions that these local projects have to make. So even for your 3 and 4-year-olds, it could be home-based. It's kind of hard to understand how you do preschool education in a home-based setting, but believe me, it's been done, or center-based. How often to do these activities. There's no law that says you have to give them 15 hours of early childhood, or you have to have the parents meet once a week for 3 hours. I mean, there's nothing about intensity. Do you develop your own curricula, or do you go out and buy curriculum? And also, to what extent you collaborate, because collaboration is encouraged. Obviously, without much money, you know, gee, if I'm an Even Start family and I can go to a Head Start center for my early childhood, it's a win-win. So there's a whole lot of decisions that are being made, and you'll see as we talk about how we went to recruit for this study, how all of these decisions came into play. This is old. This is back from 2003 when we started the show and did a lot of trainings. It's just so interesting, and you know, everybody's heard of Head Start. You probably with that won't admit if you haven't, but you know, Head Start's big, right? At that point, 6.7 billion, and here we're talking 250 million. I mean, so just think about it. But these Even Start families are just even poorer, less well-educated, less well-off than Head Start. I mean, they really, there is a needy population out there. Whether Even Start's the way to get to them is another issue. But you know, I thought this is just a really powerful statement about what the population was we were dealing with. So Even Start's been around for some number of years. Don't ask me how many. And there have been a number of evaluations of Even Start. There have been a couple random assignment studies, small, which basically took eligible families and randomly assigned them to get Even Start or not to get Even Start. And they found that while yes, the Even Start kids got better, so did the control kids. And if you follow this at all, or you follow the advocates at all, all they want to say is, well, even start kids got better. They don't want to do the but no better than the controls. It's the whole understanding it. So it's hard. It's hard, but no research to show that Even Start was working. So we thought, well, we needed to evaluate Even Start. This was a congressional mandate. So what would be some possibilities? Why might Even Start not be working? Well, one, I think pretty obvious one, was maybe the instruction wasn't literacy focused. Maybe they weren't accomplishing what they wanted to because they were just so scattered. So CLIO's main purpose was to test literacy-focused instructional curricula. The other hypothesis that we did, there were two working hypotheses. One had to do with literacy. The other was participation. Maybe the kids just weren't there enough. But we couldn't design a study that forced people to participate for a certain amount of time. And we'll talk about participation a little later. Here are research questions, and your handout will make it easier, I hope, as we go through this stuff, kind of understand what we did. And I will say, because if this gets confusing, I don't mind being interrupted. I've done this 1,000 times. We've written the report and rewritten the report. There's no logical order for explaining what we did and why we did it. So each time we do this, we start at a different starting point, and you want to know, yeah, but what about this? And I'm like, well, wait 2 slides. So this is today's order, starting with the research questions. But if you actually look at your handout, which jumps ahead a great deal to kind of the curriculum and how we chose them, we're asking if the combination of research-based, literacy-focused preschool, parenting, and parent-child curricula, so combining 3 of the components of Even Start, are more effective than the existing combination of services in Even Start. So again, if you just look at your chart, that would be treatment A2 and treatment B2. Those are what we're calling our CLIO combined curricula. So when you introduce a curricula that's literacy-focused and research-based on these 3 components of Even Start, is that better than what's happening just whatever projects are doing? And you would hope the answer is yes. The other thing I forgot to say, and it's very obvious from that slide, from the handout, is we immediately decided we could not manipulate adult ed. There weren't any curriculum for adult ed. Adult ed was kind of out there. We couldn't come up with any good way to include adult ed in this research study, so we didn't. So that was the first question. And it's really testing the family literacy model, which again, I don't believe has ever been done. And then the second question is really the value-added question. So if you've got your curriculum, your parenting and parent-child curricula that focus on child literacy, does that add value to just having this preschool curricula that's literacy-focused and research-based? So there you'd be looking at oh my God, I'm going to get this wrong, A2 and B2 versus A1 and B1. So are your combined curricula better than your only ECE CLIO curriculum? Anyway, we're going to say this many times, but this is just to kind of give you a flavor of where we were, and it only took a year to get to the research questions. So I thought the next thing would be to discuss the curriculum. So we knew we wanted literacy-focused, research-based curriculum. We knew they needed to integrate the early childhood piece with the parenting piece, which isn't really just out there in the field, and is appropriate for Even Start. So we ran a competition. IES has since done several intervention studies, and ours was the first. We ran the first competition, and we wrote a request for proposal. We advertised in Ed Week. We reached out to anybody we knew that was doing curriculum in the field, particularly in the early childhood field, and begged people to apply. We had page limits, and it's just if anybody's ever done a federal contract before, that's what we mimicked, and we ran a competition. We got 8 proposals. We formed a expert review board to review them. We didn't want to be in a position of picking the curriculum, so experts in the field of literacy, and it's pretty much literacy. We rated them. We went from 8 to 4. We had the 4 top people come in for orals. We asked them questions. We gave them questions in advance. We had orals with them, and we selected 2. And the 2 we selected, some of this will sound familiar to some of you. I don't know if I've got any early childhood people in the room or not. Let's Begin with the Letter People. Now, some of you probably grew up with Let's Begin with the Letter People, and if I hadn't been on the plane, I would have brought one. But there are these inflatables. They don't call them inflatables anymore, but you blow them up, and each one's got a letter on it with like, let's see, G, actually, because I have G in my office, is for gum, and there's this big piece of gum sticking in the letter person's head. G is for gum. B, I've got B also. B is for button. So it's a commercial software, Abrams and Company, which I believe just sold. I'm not sure who they sold to. So that was the preschool curriculum. And they partnered with Susan Landry. I don't know if you all know Susan Landry at the University of Texas Health Science Center, who has this parenting curriculum called Play and Learning Strategies, PALS, not to be confused with a preschool assessment called PALS. This is a parenting curriculum that works with parents on developing good parenting skills, relies on videotaping and constructive feedback. So Susan Landry actually put together this partnership. So that's the first one. The second one is called Partners for Literacy, and this is was done out of the Frank Porter Graham Center at the University of North Carolina, and Barbara Wasik and Joe Sterling, if you all have heard of them. And they built this on the Abecedarian model, which actually did prove some effective results with these intensive curriculum. And for the it built a lot on these what they call literacy games for the children and learning games for the adults, and a lot of scripted how to draw out these literacy interactions. They had, I love this, they had the 3 N's for the kids, which is notice, nudge, narrate. And then they also, for the adults, had the 3S strategy, which is see, show, say. So it was very literacy focused, but very, very hard. It was a lot to learn. Okay, so I think that's what I'm going to say about the curriculum for now. So our design was to recruit projects, and this slide's actually in the wrong place, I think, but anyway, to recruit projects to participate in the study, the key being they had to agree to be randomly assigned to one of 5 study groups. So my next slide is the one you have in front of you, although that one looks really ugly and the one you have looks really pretty, so I'm not sure why. So if you just let's take where we are now. So we know that we have Let's Begin as our CLEO early childhood curriculum. We have Let's Begin and PALS as our CLEO early childhood and parenting combined curriculum. Barbara really messed us up because she wanted to be called Partners for Literacy for both of hers. It's just little things that'll trick you. So we have this ECE Partners for Literacy, which is our preschool CLEO curriculum, and then we have the ECE-PE Partners for Literacy, which is our combined curriculum. Our control group is whatever they're doing. Our adult ed is whatever they're doing. And in our, what we call here A1 and B1, but in our ECE only groups, their parenting is whatever they were doing. So that's how that works. And so we had 5 study groups, 4 treatment, 1 control. I think we can see that from the columns, 2 that implemented the combined, 2 that implemented the preschool only, and then our control. For some reason, this is here twice. I'm going to skip over it. So, recruitment. Oh, my God. So, when we, actually, the numbers are on the next page. So, think about what we needed to do this study. You certainly needed center-based early childhood. You certainly wanted enough people in a classroom to make it worthwhile. I mean, these interventions are expensive. The training is expensive. You know, the assessment and observation is expensive. You can't just like go into a classroom and there's 1 kid. So we set up some rules that we thought were not unreasonable. I think we had we may have started with 8 kids in a class. We had to relax our rules, and I won't even want to talk about what it ended up being. We thought to make a true test, wouldn't you want at least 12 hours of center-based preschool? Yes, that was not a rhetorical question. We had the projects had to, of course, be able to control the preschool curricula because they had to take what they were randomly assigned and then be willing to take their assignment. I don't know if anybody in this room has ever tried to recruit for a random assignment study. It's really interesting. It's really interesting with people who probably it's probably hard even if they do understand it, but boy, talk, and I'm not putting down school people, believe me, I love school people, but I don't think this is anything that they kind of learned or were raised to think about. So, and I did some of the recruiting myself, so would you like to be in the study? Absolutely. Can I have Let's Begin? No, I can't promise you'll have Let's Begin. Okay, I want to be in the study, but I know my curriculum is better, so I'll just be in the control group. No, it's not going to work either. So, I mean, there's just, you name it. I mean, it's nice. I mean, it's all nice conversations, but it's really hard. It's really hard to get the concept across and why they would want to do it. Now, we didn't force anyone. Nobody was required. This is not representative. This is purposive would be the word. I mean, anybody who would go, we're like, yes, please, come on board. So we weren't going to force people to do it. We couldn't. I mean, we knew that wouldn't work. And in the few cases that we sensed ambivalence but really needed the numbers, we really encouraged them to do it, and we're generally sorry afterwards. I mean, you can tell somebody really doesn't want to do it. Don't force them to do it. So look at these numbers. Oh my God, this is so horrible. Okay, so when we started in spring '03, there were 1,150 Even Start projects. We did a screener call. We rolled out, because we were going to be doing in-person assessments and observations, we rolled out Alaska, Hawaii, and Puerto Rico. My project team wasn't happy, but we really didn't have a choice. It's amazing that $30 million will not get you to Alaska, Hawaii, or Puerto Rico. And of course, Puerto Rico, you have the whole Spanish situation too. So we called 1,127. We actually completed calls to 967. And basically we were trying to find out, do you do center-based early childhood? How many average numbers of kids in a class? Number of classes, number of hours. We had 439 who met the criteria from the screener call. Well, I don't know what you all think. That was kind of low. I mean, there's not a lot of projects. I mean, you just think about these projects aren't providing early childhood the way you want. So, okay, so we called 439 projects and found that 131 really weren't eligible. Maybe we'd spoken to the wrong person, or maybe the situation had changed. We got 188 who weren't interested, or we did have some who were interested and we just couldn't get the district to agree, couldn't get the agreement we needed. So when all was said and done, and we did this in a 3 or 4 month period, because what I forgot to tell you, because I'm in total denial about it, is although the department took their time approving the study in February 2003, they wanted us recruited and out in the field in fall doing baseline data collection. So we had to recruit, we had to get our curriculum developers, we had to develop our measures, and we had to be out doing data collection. So we were really pushing it. So we got 120 to agree to participate. We had, and I think most studies do this, the slide here says partnership agreements, or like memorandums of understanding. You'll do this, we'll do that. If you're ever doing a study like this, you have to do that, because and I think maybe the next slide or so talk about challenges, but challenges in implementation, but you get leadership changes. And so, Susie agreed, and Susie signed the piece of paper, and, that's in the spring or the summer, and in the fall, Susie's gone, and Johnny's like, I'm not doing this, and I'm like, you've got to, and he goes, no, I don't. And I'm like, yes, you do. And of course, Johnny's right, he really didn't, but, nobody says no to me and gets away with it. Or lives to talk about it anyway. All right, now that was scary. I can't get it to, what am I doing wrong? Oh, I waited too long? There we go. So one of the things we were worried about, because this was so take what you can get, we have big projects, we have little projects, we have some projects with a lot of Spanish speakers, some with not as many Spanish speakers. And the other thing that was a challenge and scary for us is these, I didn't say this earlier, even starts at state grants. The money goes to the states, and the states run competitions. And the districts or the organizations that win these Even Start grants, they're good for 3 years. So every 3 years they have to re-up. So we could have, and in many cases did, recruit a project that maybe only had 1 year left in Even Start. We tried not to, but we might have. I mean, because we were desperate, as you can tell at that point. 120 was like the bare minimum, because you've only got 24 in each study group. So we decided to stratify on year up, because we didn't want any one group to lose, to disproportionately lose people who didn't get refunded. So that's what we did. We formed all these strata, and the statistician, I don't have any statisticians in the room, insisted we had to say region because it just looks good, But by the time we got the region, it was like, whatever, But we were in 33 states. We were fairly well distributed across the country. I don't have a map there with me. Okay, so what did we do? This is, again, where it gets a little confusing. So we did a year of baseline data collection, which I'll get to in a minute, in fall 03 and spring 04. And then in summer 04, we implemented this for 2 years. I'm sorry, I didn't tell you that either. So in summer 04, and then again in summer 05, we brought all of the projects, we brought the A1s and the A2s together, and the B1s and the B2s together. But some got the parenting and some didn't. To meet with the developers, we ran three trainings, one on the East Coast, one in the Midwest, one on the West Coast, 1 week each. Every project brought their staff and got trained. And we actually did a pretty good job of getting the staff trained. So they got trained in the summer, and then there were 2 years of implementation. And part of what they got, besides these fabulous curriculum, is ongoing support from the curriculum developers who actually visited them throughout the year also, and were always on call to work with them. So that's how that worked. I'm not sure why that's before this. So we had 3 years of data collection baseline, and then we're collecting outcome data in the 2 years of implementation, which is spring 05 and spring 06. Here's where my retention challenges come in. Leadership turnover, teacher buy-in, acceptance of their assigned study groups. So I get the call, I'm in partners, and I told you I wanted Let's Begin. I didn't want partners. And I'm like, no, sorry, you didn't tell me that, and this is your assignment. What we did is we insisted that any project who had agreed to be in the study stayed in the study for data collection. But if they absolutely refused to implement their curriculum, we couldn't make them. So they became a what? A non-user, I guess. But they're definitely in the study. And we didn't have anybody who dropped out. We didn't have anybody who stayed in the study who didn't allow us to do data collection. We lost a couple because they actually weren't refunded over the years. But we always had baseline data. So anyway, it's frustrating because it's frustrating, but it's, I guess, life. That's probably one of the realities of doing a study like this. As you can probably imagine, we collected a lot of data. Next piece of advice, don't collect a lot of data if you don't know what you're going to do with it. But I guess we all do. I actually think we did a pretty good job, but okay. So, and I think I've got another slide that talks about the outcomes. It kind of explains what they are, but this is just kind of the overview. So we did child literacy assessments. We did parent assessments. I will say right now, if anybody's thinking, why did they assess parents? Because they weren't trying to change parent literacy, you'd be absolutely right. And if you had been with me in 2003 and told me that, I wouldn't have assessed parents. It was a mistake. We didn't need to, but we did. Parent interviews. And what was, I thought, really, integral to this, if you think about these parent-child interactions and the parent and child working together, we videotaped staged parent-child interactions. We put the parent and the child in front of a video camera, and we had a reading activity, and we had a playing with the toy activity. We developed coding modules, which we, or video, sitting in front of a videotape coding, but then we coded afterwards. So the field staff only had to be trained in using the camera, and then we came back and coded it. And it was actually a really good exercise. So that was the child and parent data. Classroom observation data, we went into the preschool classrooms and the parent, and both types of parenting activity. Classrooms and observed instructional activities. We also brought with us fidelity checklists, because clearly one of the things we're interested in is the fidelity to the implementation of the curriculum. For the projects, we insisted on getting monthly parent and child participation information because we had certain hypotheses. One is, well, certainly we thought fidelity of implementation should matter, and we also thought participation should matter, that the more you're there, the more you're exposed to the curriculum, the more you might actually see outcomes. We had the teachers rate the kids, which I'll talk about a little later how we used it, and then we did the teacher and project director surveys to get some more kind of background information. Now, somebody told me, I can't remember who, that you all might be interested in how we collect data, and I'm not sure if that's true or not, but if it isn't, I can do it real fast. If you haven't never done a big study, you might want to know how that's I'll do it real fast, but if everybody wants me to just move on, just tell me. So at Westat, we put somebody in charge of data collection. Happens to be the same person who's in charge of data collection for DC Choice. So many of you probably know Juanita and Milwaukee. So Juanita was in charge, and Juanita finds field managers. It's like, you always want to find somebody who's below you can do the work. So the key here is to keep kind of pushing it down as best you can. So that's another piece of advice. So we had field managers, of which Sylvia was one, if you all know Sylvia from Milwaukee. And then we go out, then we basically rely on field-based staff, and this is the most kind of cost-effective way to do data collections. And Westat does a lot of big data collection. Westat does NAEP, the National Assessment of Education Progress, where when it's a NAEP year, they have hundreds of thousands of assessors out in the field collecting data. I mean, Westat does know how to collect data, I will say that. So we have these field-based site coordinators. We hire people, we call them here assessors, interviewers, so they did the child assessments, the parent interviews, held the camera up, and you can train almost anybody to operate a video camera except me. And you don't want to do it in front of the aquarium where the fish are around, because you'll hear the fish gurgling. That's in the background. A lot of things you learn. And then we got field-based observers to go into the parenting classrooms, but I'll go into this a little bit more later. The early childhood classroom observations were really difficult. Since this was a literacy study, we really wanted to get a feel for what was going on in the classroom. And I don't know if I'm going to put my foot in my mouth and step on any toes here, but what's traditionally been used, or certainly back then, is the Eckers. And if I have any Eckers fans, I apologize. But the Eckers, you go in and you stick you stick your pen in the soil to get the quality of the soil in the playground and hygiene. And I'm sure it's great, but it's not great for literacy. And so we didn't want to rely on the Eckers. So we actually used researchers to go into the early childhood classes. And training is really important. Obviously, you have to train to get the store. So that's my 25-cent version of how we collect data. So what did we do with it all? Well, the child literacy was the big thing. So we had to cover a lot of ground on child literacy, and we really tortured the kids. And what the kids got at the end of the torture were stickers, and they love stickers. Like, oh, if you can just sit for 10 more minutes, you get your sticker. Okay. I don't know how they do it. It's fabulous. So we looked at expressive language, and we used, again, I don't know if you all are interested in the tests we used, but we used something called the IGD, which is the Individual Growth and Development Indicator, and it's a picture, and you have to say what the picture is. We used the PBVT, because everybody uses the PBVT, and we didn't want to be the first study not to use the PBVT. And that is why we use the PBVT. But what's really important, we thought, for this developing literacy is phonological awareness. And I don't know if anybody knows, Chris Lonigan has developed the pre-CTOP, Comprehensive Test of Phonological and Print Processing. So we used that test, which he's now sold to ProEd, I think. So we looked at elision and blending, and then the print awareness is also the CTOP print awareness. Syntax and grammar, we use the test of language development, grammatic understanding. And then social competence was the teacher rating. That's why we had the teachers rating the kids on a number of dimensions, and we created a scale there. That's how we tortured the children. Tortured the parents with this assessment battery, which I want to say no more about, other than included PBVT and a battery of Woodcock-Johnson tests. And then when we coded the videotapes, we used factor analysis and came up with two measures, which we called interactive reading skill and parent responsiveness to the child. They actually really seemed to hold together and be what we wanted to measure. So I have to tell you, we were pretty excited about that, because you never know. Did a lot, we had a lot of instructional variables, and a subcontractor to Westat was Apt Associates. I don't know if anybody knows Barbara Goodson, but she kind of took the lead in this. This is a passion of hers, and developed a battery of tests that were so complicated. It took a week to train, and as I said, we used researchers. There's no way we were training field staff on this. We made her boil millions of data items down to 5 outcomes. So these were the ones that we felt that were the most important. The adequacy of literacy resources, support for oral language, support for phonological awareness, support for print knowledge, support for print motivation. So that's the first 5 are the ECE ones. Then remember, we were in parenting ed classes, and we thought there, We had heard anecdotally that these classes revolved around, what are we having for lunch, and what did you do yesterday, and what are you doing tomorrow? Not a lot of literacy. So we thought, well, if we could get literacy into the classroom, that would be good. So what we were measuring, and we were using field staff, remember, so we just couldn't get as sophisticated, the time spent on child literacy and time spent on parenting skills in the parenting ed classes. And then we had these where you put the parents and children together. And interestingly, again, anecdotally, you'd walk into a classroom and there'd be the parents talking about what they had for lunch, and you'd have the kids doing whatever the activity was, because of course kids will do any activity you ask them to. So the whole idea was to put them together. And so we looked at the time that the parents and child actually spent together interacting on a child literacy activity, and then our monthly hours of participation, because we were so sure that was going to matter.
Ben, can I interrupt and,
Please.
and just ask about the centers, so we can get a feeling for who they are. These are
The Even Start centers.
The Even Start centers. These are preschool centers that are public or private. Are they in regular schools?
Everything.
They're everything.
Yeah.
And they apply for the federal program
Through the state.
Through the state.
It's a state
Department of Ed.
right.
Okay. So the State Department of Ed applies.
Well, it's a formula. It's a formula to the state. So each state gets money, and then they run competitions
Within the state.
within the state to
and
fund.
certain centers,
Yeah.
whoever they are,
Right.
get chunks of money
Right.
from the state through the Fed, and it comes out to about, there are 50,000 kids, 250 million the first year, so it's about 5,000 a kid is the grant. Is that the entirety of their funding, or is that supplementing other funding?
Well, they're
that they
supposed to
have?
coordinate with. That's why one of the requirements is to coordinate. So you find, and one of the reasons we lost a number of projects is because they send their preschool kids to Head Start. So your mother or father, your mother more likely, could be getting your adult ed, and the kids getting Head Start. You collaborate with other existing services.
Okay, so the funding, the 5,000 is not funding in full for these centers. It may be supplemented with other grants that they're getting also.
Right, like adult ed's often given through an adult ed program that's not being funded by Even Start.
And they have to offer at least 12 hours of instruction in a week.
No, we wanted 12 hours of instruction.
Okay,
There's no requirements.
so they can get $5,000 per
It's not
kid.
a lot of money.
Oh, I just want to
Okay.
know.
I have a bias.
Okay.
Yeah. Yes, but yes.
And they have to offer some amount, and you selected for 12 hours of instruction per week.
We would have liked that.
Okay.
Yes. Well, you figure if you're going to put an intervention in, you have to give it a shot at working. And some of them are half day, some of them are full day.
Is it all year round or 9 months?
I do have that on a slide. I have that on a comment. I'll do that now. So JD asked a really good question, so it'll give you a little bit of sense about Even Start. So it is required to be year-round. So we are, naive, good researchers, right? So when we started with the participation, we were going to collect participation data in the summer, and guess what? There's nothing in the summer. Nothing. I shouldn't say. I mean, that's black or white or true or false. There's very little in the summer. Very little going on in the summer.
Where are the kids? Are they in Head Start then?
They're probably nowhere. I mean, the parents aren't. I mean, there's nothing going on in the summer. It's just everything closes up shop.
A lot of Head Starts consolidate for the summer to one side.
Right, and if these kids happen to be in Head Start, perhaps they are in Head Start. I don't have the statistics of how many Even Start kids actually take it, or in Head Start classes for preschool. Our theme for 8 years was it varies. If you asked us a question, the answer was it varies. I'm not here to either praise or kill the program, but you guys can draw your conclusions. So we ended up with about 1,200 students, 1,200 kids and their parents who participated in our study, which is a nice little sample size. So I'm going to hit you with fidelity first, or not. Okay. So I think there's a lot of research that suggests that we don't really know how to measure fidelity. It's probably true. This is what we did. We actually thought we would ask our curriculum developers to say how well they thought the projects had implemented, because the truth is they didn't have any reason to sugarcoat it because they knew we were going to use it in their analysis. I mean, they'd be better off lowballing it and then looking better than we just felt really comfortable asking our developers. We had a 5-point scale of not much to a lot. And then, as I said, when our observers went in, we also had a checklist, and we're trying to kind of get a sense of fidelity. So you all can read the bullet. There wasn't, it wasn't great, and it wasn't horrible. I was kind of in the middle. I think the study's over. I'm allowed to say this. Let's Begin in PALS was easier than Partners for Literacy. Partners for Literacy was really hard for the teachers to do, so it probably explains that a little bit. Not surprising that the numbers were higher in the second year than the first. I mean, that was one of our hypotheses. So we have a ton of implementation going on. That's what we found. More interestingly, I can't do this. Come help me. What am I doing wrong?
Just use the keyboard.
Oh, I could use a keyboard. Nobody told me I could use
Yeah, hit an arrow key on the forward arrow key.
that.
No.
No, that.
Nope.
Well, just hit this.
Right here.
Okay, so I think most of us would agree that you can't really benefit from an intervention you're not exposed to. And you don't get a lot of participation in Even Start. I think foreshadowing the findings a little bit here too. But because they're not required to do a certain amount, I see we use the word vary. I mean, it really did vary. So on the project director survey, we asked them how many hours did you offer, and then we used painstakingly edited and used the actual participation data we got by child, by parent, by month, by component, by project. So you'll see that while they offered 80 hours of ECE a month, they actually participated in an average of 50 hours a month. It's not a lot. And on the PEPC, they offered 25 hours and they participated in an average 13 hours. There's not a lot of participation going on. And again, anecdotally, and you didn't hear this from me, if you go to visit an Even Start Center and it's raining, you will not find anybody there because they don't hang out in the rain. Now, true confessions. Oh, what am I doing wrong? Oh, I'm going the wrong way? Oh. All right. I had a fabulous analytic statistician working with me, and any stats course I took was 1,000 years ago, so this is where I'm actually the weakest. And if you guys have any methodological or analytic questions, I'm going to refer you to the report, or I'll write it down and get back to you. This is just not my thing at all. I can tell you we use covariates to try and help us. The project was Univ analysis. We combined 2 years because we thought we needed it for power. Interestingly, it turned out we didn't. And we used HLM because the department at the time loved HLM. So, okay. So these were research questions, and goes back again to the handout. And getting the research questions was easy. If you a little exercise for yourselves when you go home, you can think about how many contrasts you can get from those research questions and from those 5 study groups and all the different combinations. We spent probably, I don't want to talk about how long, trying to figure out what it is we really wanted to ask. How did we want to combine what we did to answer our questions? I think the report actually lists these. What we really did, and I'm actually going to get to the findings on the next slide, is we looked at, oh my God, where's my A2 plus, well, I think what I told you originally. So we looked at the combined, the two combined. We combined the two combined, so A2 and B2, and compared that to control, a research-based literacy focus. Combined curricular better than the control, better than what's going on. And then research question 2 was a value added. So we combined the A2 and the B2 and compared it to the A1 and B1. So that's primarily what we did, although it took forever to get to that point. All right, what did we find? We had so much data, we had so many findings, we had so many questions, we had so many contrasts. It's actually hard to figure out how to present the findings. And I'm not yet convinced we did it right. No, our findings are right. I'm not convinced we found the best way to do it. These are the slides we ended up with, so these are the slides you guys are going to get. One of these days I'm going to get it right. Okay, boo-hoo. Overall, there were no statistically significant impacts on any of the 7 measures of child language and literacy. So first I'm going to tell you how it looked for research question 1. So we didn't help children's literacy. We did have a positive impact on the child social competence, which is that teacher rating form and some parent interview questions. So that was good. What do we do for parents? Well, we did help parents, actually. We had statistically significant positive impacts on our two measures of parent interactive reading and parent responsiveness. And shockaroo, we didn't impact their reading and vocabulary skill. If we had, I don't know how I would have explained it. We didn't, so that worked out well. Then when you get to instruction, and there's a lot on this slide, we had 5 preschool outcomes, and we had statistically significant positive impacts on 2 of them, the support for print knowledge and literacy resources, and did not have statistically significant impacts on the other 3. Then when you look at the parenting ed, parent-child, we did find a statistically significant positive impact on the PE time spent on child literacy, but the other 2 times, both PE and PC, we didn't find one. So, wait. And we've got this is the value added. So, guess what? The CLEO parenting curricula did not add significantly to the effectiveness of the preschool on any of the 7 measures of child literacy. Maybe you wouldn't have expected it, I don't know. That's 2 levels down. But where we were hoping, of course, was to affect the parents, and we did have a positive incremental effect on the parent interactive reading skill, but not on the parent responsiveness, and certainly not on the reading skills. What would you? Then for instruction, let's see, you can see what the incremental effect on PE time spent on child literacy and on parenting skills, which was nice, but not on PC time, and certainly not on any of the instructional models. Instruction. Alrighty. So, did they vary by year? Because, as I said, we combined the 2 years, and unfortunately, we did look at it by year, and yeah, unfortunately, we found that in the first year we had statistically significant negative effects on 4-child language and literacy outcomes, and that wasn't good. So the question rose, of course, did introducing the CLEO curriculum hurt the kids? And by the second year, that had not. There was nothing negative. But what happened as a result of those findings is the department decided to fund a follow-up study to follow those kids into kindergarten and first grade to find out if there were any lingering kind of negative effects. So that was kind of a bummer. We were kind of sorry to see that happen. All right. Woo. Oh, that was, okay. We did a couple of exploratory analyses, again, looking at fidelity, looking at participation. We were looking anywhere to see what we could find. We didn't find too much. This is, you guys can read it. I mean, we just didn't find that much. Interestingly, we thought fidelity would matter. Maybe there just wasn't enough variation in fidelity. We just didn't really find much. A little bit. The little things we found, you kind of like, oh, why, or who cares? You know, it's just, couldn't really tell a story. On fidelity, we looked at variation in child outcomes by preschool instruction and parent behaviors. We found a little bit, but you know, again, I'm not trying to be dismissive of what we did. I think we ended up with the sense that we had really tried. We had a lot of good data. We just couldn't make much of it. We just were left with kind of not sure. Participation was interesting because I was convinced there was going to be something was going to come out of participation, and we found, you know, a little bit, see in the beginning, but there wasn't a lot. And then we thought, well, what if we pulled off real significant, you know, the people who really were there a lot, you know, some amount of time that should have mattered, which is the second bullet, and didn't find anything there either. So the next steps are, as I said, they awarded us a contract to follow these kids. We've actually finished data collection, and we are in the middle of analyzing the data. And this is a really old slide because early 2010 would be now, and guess what? No report. So, and no, I can't tell you the findings, but why did you care? So that's why I said, so we had this big study, a lot of money, a lot of work. And has anybody ever heard about this study or read about it? It's not Ned Week. That's why I did the, you know, like the tree falls in the forest, does anybody know? Which maybe is okay because we just didn't find, I mean, maybe if we found, well, I mean, obviously if we found something really dramatic one way or the other, I think we did a good study that's what it is. So what's the lesson learned? I don't know. How much time did I take?
Well, are you ready for Q&A?
Depends what they are.
Okay, well, I will allow you to go ahead and manage your Q&A. Questions from the audience for Babette?
So it may not have shown a lot of change, but it does show that we're putting quite a bit of money into a program that doesn't necessarily produce results. And then it didn't get any publicity in Ed Week or programs like that. Is that because it's not really a popular finding?
Yeah, oh, absolutely. In fact, what's happened is, and this has been Republicans and Democrats, this is not a partisan issue. Both Bush administration and now Obama administration have canceled out Even Start. And what you'll find then, and what you will find in Ed Week and Ed Daily is, well, we have to give Even Start a try because nobody's ever done a good study of Even Start. And what they go back to are those earlier studies I referred to, because they don't understand, the control group did as well as the Even Start. So they knock that, and they never mention Clio. It's like Clio didn't exist. It's very odd. I don't know why. OMB constantly gives it a bad rating on PART, if you all know what PART is, which I'm forgetting, but it's how OMB rates programs. I mean, it's just, there are people who believe it should be discontinued, but Congress doesn't, and that's what ultimately matters. And it's got this constituency led by Goodling, who's no longer there, but his legacy remains, and that's why.
Can we really consider this an evaluation of Even
No,
Start?
you're absolutely right. We cannot. Yes.
Because I mean, you're just comparing the
Yes.
curriculum of
You're
one
abs-
and the ones in the control are also.
He's very smart. Yes, no, and if I spoke loosely, you caught me on it. That's absolutely correct. It's an evaluation of putting these literacy models in Even Start programs, but it is not an evaluation of Even Start. That's correct. However, don't you wonder if you give them really good curriculum and nothing happens? But you're right.
Well, one of the challenging things in early childhood is a good curriculum is not going in with a literacy or science, math, or physical, because everybody says we need more physical in there. And so it is like this. So if you go in with one curriculum and you've got everybody else out here teaching those teachers that that's not the way to do it, it's a hard thing to,
I think, I'm not sure I get your point, but I think you're right. But maybe what I didn't say well enough is it wasn't just a matter of like the curriculum, but the curriculum came with a lot of professional development, helping teachers not just learn how to like use the letter A or how to use the literacy games, but how to infuse their classroom and everything they did with literacy activities. And so the whole idea was to make it a more literacy-rich environment, which I'm telling you these Even Start classes are not and were not. So,
if I could just follow up directly on Marietta's point, and that is, might that possibly be an explanation for your negative significant findings with the first cohort?
That they tried too hard.
Well, it could be that they had to, it was very disruptive.
Right.
Much like kids switching schools, right? That they were pressured to move away from what they were doing,
right.
to try and to experiment with implementing something new, and that the short-term effect was a lot of disruption that actually might have had a negative
Their other curriculum may have been more well-rounded and encompassed all the components they needed in all areas, and they put more focus on literacy and less on other areas.
Right. Or they were out of their comfort zone. Yeah, I think that's right.
Make sure that you see all the over on the side.
Okay, I'm sorry, I'm not paying attention.
In one of your exploratory findings, you did say parent responsiveness was significantly impacted all outcomes. Yeah, the last bullet there. So how did you measure parent responsiveness? Was that the video?
Yes, that was the video.
And that was just exploratory?
Yes, because, right.
I think that's something to do more with. Plus you have that whole data bank of video. Would you let other researchers?
Yes, I was just going to, yes, absolutely. And in fact, if you're interested, let me know what, that's a really good question too. IES houses the National Center for Education Statistics, which is the police for restricted use data sets. And so it's really onerous, but we're contractually bound to create these restricted use data sets that you then have to apply for a license, and then you have access to the data, and it's basically, it doesn't have any personal identifiers, but it's the raw, it'll allow you to do anything you want. we unfortunately hit a little snag on it, but we're real close to having them ready. So yes, you can. I would be more than happy to give you that data set. I mean, tell you how to get
You're looking
it.
for some things,
Yeah.
but I think
Right.
to have that of parents and children.
I think that's a really good. I think that's a really good point. Yeah, I think that's really good. Thank you for being positive. I appreciate it.
Two questions. One was relating to this. What did you mean by the statistically significant negative associations on the Spanish speaking issue? I didn't understand what that meant to begin with, but I have a different question.
Well, we did. I'm not sure. Okay, I mean, there could be 3 questions on that one, but because enough of our children were Spanish speaking, we did give a Spanish test. So we did that expressive vocabulary in English and in Spanish. That's what the Spanish Indy is. And what does that bullet mean?
What does it mean, the negative association?
So if you look at some of our there's a huge table in the report, but if you look at some of those preschool instructional variables, they were negatively related to how children did on the Spanish AD. Why?
Variables we expected would be positive.
Well, we weren't trying to do any harm. I mean, we didn't have any.
All right, I mean,
I think classroom attributes that you expected to be positive instructional.
Yes, right. We only looked at what we thought was what we'd want in a literacy-rich classroom. Yes, yes.
But my basic question was on what was the whole idea for Even Start, which I do not remember much about at all, ever.
Family literacy. Somebody came up with this.
Did they ever have any
No.
models to go on? Did they ever have even one pilot experiment?
I don't think so.
So that they had some sense of what the dimensions would be? I mean, it was just some idea that someone had. Sounds good in the abstract.
Right.
But the question is, did they ever have anything to go on?
I apologize. I don't know. I inherited this, but I don't know that. But I don't think so, but I wouldn't want to say no for sure. But, you know, it's kind of this belief that you put these 4 pieces together, they ought to work. I don't know if there had been a
pilot. Money for a program, and my question is, where would anything have come from to suggest that there was such a thing?
I think even started back in the 60s, maybe? I can't remember. I'm sorry. I just don't know the history that well either. But it's like with a lot of federal programs, though, quite frankly. I mean, somebody puts money out there and then that's it. And once you get the money, it's hard to take the money away, whether it works or not.
This is so enormous.
Sorry, you didn't want me to be a downer, did you?
So if I understand this, you found no value added from parenting education once you had the preschool. Is that correct?
I think we found a value added on one of our outcomes. Didn't we? I don't do findings. Okay, you asked the question while I think about that.
The question I was looking to was the structure of the study does not allow you to didn't do the reverse. It doesn't look like there was anything with parenting education along with it.
That's correct. That's correct. Right. Because that wasn't the main for us. I mean, we weren't looking at parenting education in and of itself, but only as it combines with.
Do you know what the relative cost is of parenting education versus the preschool education?
I would assume it's fairly small. I mean, they don't. I mean, they don't meet that much. They don't do that much.
So you're right. I had never heard of the CLEO evaluation.
Just breaking the function.
And there's very little coverage of it. But there was also very little coverage of the Head Start evaluation, a much bigger program that was just released, finding no lasting effect from Head Start participation. Very high quality random assignment study with people we know involved in conducting the evaluation. I was not involved.
You heard about it though.
I just happen to be a junkie.
It made some press.
But I don't think it was covered by any of the 70 major metro newspapers in the United States.
I'll believe you because I know you know these things. I
was just, because I was.
And so yeah, it's fascinating, isn't it? I know what you're going to say.
Why? What am I going to say?
Well, because it wasn't what the administration wanted to hear.
No, it's not this administration.
I'd say.
Last administration. It doesn't. I mean, everyone loves Head Start,
right.
Despite repeated evidence of no lasting effect.
Right.
But everyone's for it, and So everyone's for family literacy. I mean, are you against puppies? I mean, it's...
Yes, I am actually. Bad question.
Right. So
Cats also.
we wanted. That's because we wanted to figure out a way to make it work. We want these things to work now. So which actually that was just a statement. The question part is that Russ Whitehurst has said since leaving IES that we know what works with instruction. In fact, we know a lot about how to do instruction. We have all this fantastic random assignment evidence about how people learn, and there are really big effects from that, but we don't know anything from these systemic reforms, from changing incentives of systems. That stuff is all weak, and we have very little evidence on it. Why are we wasting all of our energy on these systemic reforms when we should focus on the instructional reforms? What this says to me is you get some of the leading experts together on curriculum, and perhaps it's the case in small laboratory experiments they're able to show effects from their approaches, but in the field it's extremely hard to pull all this stuff off, and you end up with no effects. So which pond should we be fishing in? Does this warn us that we shouldn't be concentrating on instructional issues?
I have no idea. What do you guys think? I mean, are we starting to concentrate on teachers now? Isn't the big thing teachers? What are the teachers doing, right? Right, Gary?
So just, but wait,
Let's
we're going to
just blame it all on the
people,
teachers.
But it doesn't matter what the structure
No,
is.
I really don't. I mean, I'd be curious what your answer to that. I don't know. Well, but Jane knows I'm discouraged about the state of education anyway, so probably not a good time to be asking me this question. If you've done it as long as I have and everything keeps going around and around and around and not much has changed, then I don't know what the answer is.
Could I ask a question that sort of is related to that? Do you have any data on who are the people running the programs, working in the programs? I mean, part of the Head Start issue is that it's
the credentialing.
Agency.
Yeah.
And I don't know anything about
we
Head Start.
we did probably a little. I don't even know if it's in our report. I mean, with the teacher survey, we asked years of experience, degrees. They're not. I think they are degreed. I think that at the Even Start, teachers as opposed to the aides are degreed.
In charge of the programs as well.
Yeah.
I mean, who's organizing this? What's their background?
Yeah. I don't know if we know that. I don't remember it offhand. I just don't remember. I don't remember if we asked.
You don't know if you asked.
I don't remember what we asked. Yeah.
You had several hundred programs in the evaluation, so were some of them sort of effective?
Well, I mean, how would you answer that? I don't.
Well, I see you're collecting statistics from each of the couple of hundred.
Well, we had 120.
Positive outliers?
Yeah, the positive outliers.
But at the individual program level?
We don't have enough power. How would I know that? I mean, I'll give you the data. I just don't know. I'll ask David also. I mean, the only thing we tried to do to carve off a piece was with that participation. We thought, well, let's find those projects that really had high levels of participation and see what the action was there. And we didn't get any.
So it seems like in here we're a lot of us are saying, well, man, it seems like Even Start's not really doing anything, but I mean, really couldn't we take this and say, hey, maybe Even Start's really doing a good job because we came up with this really dynamite curriculum with some experts, we put it in place, and it doesn't do any better than just the regular old Joe Schmo running an Even Start facility. So maybe the regular Even Start is just as good as these really well-designed curriculum. So maybe Even Start's great.
No, but there's already been the studies that said that it was ineffective. And so this is, I think, a follow-up study to say, well, maybe if we do it right, it will be effective. This is building on a foundation of development.
There were some small random assignment studies that, like the Head Start one, but on smaller scales, that did the random assignment to Even Start and not to Even Start, and didn't find Even Start to be effective.
I just feel like this study, I mean, we're looking at curriculum. It doesn't seem like it does anything to really evaluate Even Start. I mean, it seems like
no, I agree. I mean, I understand what you're saying. No,
right. And not necessarily Even Start. So whatever findings we come up from this, it doesn't tell us much about this, Even Start as a whole.
He's definitely a half cup full type person, isn't he?
Kids aren't doing well when they get into regular school.
So you are possibly dejected about the state of some things. So if you were King for a day or Arnie Duncan for a day, how would you use our federal ed budget differently?
God, that's an interesting question. Give it all to Westat.
Give it all to Westat.
Well, I don't know. Maybe I'm trying not to be cynical. Maybe I'd be interested to see how these I3 grants come out. I'll be interested. I mean, some of the new stuff, the Race to the Top, I3, the I3 grants. I mean, just maybe if you really try something different. I mean, the thing is that it's just.
What's I3?
It's the same old. It's investing in education. So that's I3, and it's big pots of money for either kind of demos or bringing to scale kind of real reform.
But what kind?
Well, I don't know. I haven't read the application.
That we're still wrestling.
Right, and I'll tell you, this, from what I'm hearing, the department's kind of settled on 4 models for turning around schools.
Turn around.
And one's charters. So again, I'm an agnostic about charters, but one's charters. One's close the school.
Turnabout partners.
I'm not going to get them all. If I'd known I was going to need to, I would have brought my notes. One is you have to get rid of like the principal and half the staff.
51%.
I forgot what the. I mean, but you're just betting betting on those, right? I mean, everything's just a bet, and it's what the latest bets
There's no
are.
evidence for most of that stuff.
I think that's right. I think that's right. I am convinced. Okay, guys, I've been doing this for 35 years, and I said, and I came into education wanting to be a math teacher, but I had to take 3 semesters. The people at breakfast heard this, so I went to University of Maryland. This was in 1970-something, 68, and I said, I want to be a math teacher. 68? No, I was thinking, I know, God, can you believe that? 68. I went 1968. No, I'm not lying. And I wanted to be a math major and just get enough credentialing to be able to teach, which is the model today, right? But back then, and I just made it up. I couldn't major in math because I needed 3 semesters of science. I hate science. I couldn't find a science I could pass 3 semesters on. So that's why I'm not a math teacher today. But we've all been in classrooms. I mean, I think we have to start with the teachers. I mean, I know what are the teachers supposed to teach. I'm not dumping on teachers. Don't get me wrong. But we know that teachers aren't all of good quality, and the kid's not going to learn with a bad teacher. They're just not. I'm convinced that somehow we have to hit the teaching field. But I don't know what that means exactly. That's my 2 cents.
Okay, last question from my colleague. Make it a good one.
You probably put this slide back up
Oh, 'cause I was
for a reason,
Yeah.
and it looks to me like it's a good reason, which is this is a very,
Yes,
very disadvantaged
yes,
group.
that's exactly right.
Okay.
Yeah.
And although you want to work on the teacher side of it, I think we don't want to give up on
It takes a village.
which is the parent. I mean, I think the parent is a big thing, but this is a really tough parent
Right,
group.
that's exactly right. That is why when we were talking about.
And that doesn't, so I don't think that means that, parent education can't.
Oh, and that's why you
can't
asked about
work.
the parent piece. No, of course.
Yeah.
Of course.
Maybe it's really hard to get it work. Maybe you should have a shot, maybe the federal government should maybe have a shot at trying out with a slightly less disadvantaged parent group. I mean, it's only 15%,
Yeah, it's horrible. It's horrible, right? Right.
So.
Yeah, no, you're right. You're right.
Okay, well, obviously, that got us thinking and got us talking.
Well, thank you all. This is like the most fun I've had on Clio since we designed the logo.